This segment sponsored by Aesthetic Center at Woodhome.
Have you ever been interested in getting some work done but are a little hesitant?
Well, today we're talking beauty trends of the face and body with Dr. Emile Brown. Good morning. Good to have you.
Thank you very much for having me.
Of course. So you're a plastic surgeon. You do surgery of the face and the body, but there seems to be a lot of hype surrounding one thing, and that is PRP. What is it?
So PRP stands for platelet-rich plasma, and that's basically a portion of what circulates in our bloodstream that we can isolate, and it contains a lot of growth factors. And when we inject that or use it topically, it really stimulates regeneration. And so it's been used in many medical fields. Orthopedics, it's used injected into joints or for sports injuries, and they've seen a lot of success for that. And now it's translated into the plastic surgery world. So we're using it for a lot of different uses for rejuvenating the face, the scalp, the body.
Okay, so for the scalp, can somebody
Yes.
who's bald use that?
So the way it works for hair restoration is basically when we start to have our hair thin, our hairs get miniaturized and they get small, and so you can't really see those hairs, but they're still there. The hair follicles are there. And what the PRP does is that those growth factors turn on those hairs again and make them grow into full, healthy, new hairs. So basically, if someone's totally bald, they're not going to regrow hairs where they don't have any hair, but it's mainly for people with thinning hair, and it works great for men and for women.
So how many treatments are needed?
The generally recommended treatment package is 3 treatments, and that's usually spaced at least a month apart. But I have a lot of patients coming back for their 3rd treatment, and they're already seeing results with just those first 2 treatments. So it's really an effective series of treatments.
Wow, so men and women. Okay. So let's talk about the vampire facelift, because we see a lot of celebrities doing it. Is it a thing? Tell us about it.
So a vampire facelift does use PRP. It's been popularized by one doctor who did kind of trademark that name, but basically what it consists of is injecting PRP into the face, and those same regenerative growth factors that work in the scalp, they work under the skin, they work on the skin, and so it's not an actual surgical procedure. It's an office procedure that's minimally invasive, but that's basically what it is comprised of.
So, okay, so there's a face. Now let's move on to the body. There's a lot of different lifts. So tell us about some of those.
Well, I think one of the most popular ones that's gaining in popularity rapidly and has been for the last several years is what is known as a Brazilian butt lift. And that generally involves taking fat from elsewhere in the body and usually sculpting above the buttock, so we narrow the waist, and half of the procedure is just accentuating that waistline, and then that fat is re-injected into the buttock in order to further enhance that hourglass figure.
And talk to us about that treatment. How does that work? I mean, as far as like timing, the amount of treatments that you need.
That's generally, most people just have one treatment. Occasionally people will come back and say they want more volume, but generally it can be done with just one treatment. It is a surgical procedure that's done with anesthesia. In terms of recovery, the main issue is that we ask patients not to sit as much as they can for 2 weeks on their buttock, because that fat needs to have a good place where it can grow and revascularize.
Makes sense.
Okay, so if we want more information about you and what you do, where can we go?
Call our office at 410-486-3400.
All right, Dr. Brown, thank you so much for being with us.
Thank you.